Good evening. I would like to welcome you to tonight's virtual program, GentleMax Pro Plus and Frax Pro, answering the call of today's most sought-after treatments. If you have questions during today's event, please enter them in the Q&A box. We will answer as we go along. If you encounter any issues with the video or connection, please refresh your browser, as that will often fix minor issues. Google Chrome is the preferred browser. This didactic content is intended for global training and educational purposes only. Candela Corporation and its affiliates make no representations regarding federal, state, local laws, or regulations that might apply to use and operation of this device. For this reason, please review your country's current indication for use as provided by the respective regulatory agency. This content is not intended to be a substitute for professional medical advice, diagnosis, or treatment. Treatment considerations are under the discretion of the qualified licensed healthcare professional. Individual healing times, discomfort, treatment results, and satisfaction can vary. Please discuss these as well as risks and benefits of this procedure with your qualified healthcare professional to determine whether this procedure is appropriate for you. I am very pleased to introduce our moderator for this event, Dr. Kanika Shawan, Senior Vice President of Clinical Operations and Medical Director at Candela, and also with her clinical aesthetic practice based in Jacksonville, Florida.
Thanks very much, Grace, and good evening. Welcome, everybody. Thank you so much for joining us. We have a fantastic hour ahead of us, and Professor Firas Al-Niaimi, who many of you know, will be presenting in this next hour his experience with the very versatile GentleMax Pro Plus and also Frax Pro. So for those who don't know Dr. Firas, you're in for a real treat. He's a renowned dermatologist, has had many, many publications, as you can see here, over the last many years in book chapters. He's a pleasure to listen to live, especially, but certainly even on this webinar. He's had a great deal of experience in dermatology. And so thank you so much, Dr. Firas, for joining.
Thank you very much, Dr. Kanika, for the kind introduction. Good evening, dear colleagues. Good afternoon if you are in the United States joining us. I know some of our American colleagues are joining us. So as Dr. Patel already mentioned, we are going to talk about two very good platforms and devices from Candela. So for those of you who are not familiar with Candela, Candela is the #1 laser dermatology company in the world with a lot of heritage in terms of the science and the products. So I'm going to start first with the GentleMax Pro Plus. But before we talk about that, let's just review a little bit about the market, the global market. So the good news is, in summary, this aesthetic part of the market is growing, okay? This is growing exponentially, and it's projected to continue to grow. So if you are new into medical aesthetics, well, the future is bright. And if you are well established into medical aesthetics, I think you're going to be looking at opportunities and potentially devices for further growth, because this is an area of medicine that is growing. And that is growing in all parts of the world. Now, in some areas, like in Asia, there's an exponential growth, also particularly because of the demographics there. But this is growing worldwide. And then if we look at what are actually the treatments that patients are looking for, because that gives us an opportunity on where to invest and where to focus on. So you can see hair removal remains on the top of the list. Often colleagues will ask me if I would invest in one device, what device would that be? Well, the very straightforward answer will be is if you are owning a clinic, you're going to have to be laser hair removal. So laser hair removal is one of the services that continues to grow because there is demand, and where there is demand, there is obviously potential for growth. But that's not everything. You can see tattoo, pigmentation, vascular treatments, and then skin rejuvenation or facial rejuvenation, which encompasses many different treatments. So you can see that Candela, as a laser company, will provide more than 2/3 of the treatments that are needed. So certainly I can tell you about this webinar today. If we look at the GentleMax Pro Plus and the Frax Pro, well, we're targeting certainly 3 out of 4. We're targeting the hair removal, we're targeting the vascular, the rejuvenation, as well as aspects of superficial pigmentation. And that's why I'm very keen and excited to introduce these two platforms to you today. So this is the journey of application adoption, as some would like to call it, and that is, many of the clinics and many of the aesthetic doctors would start with injectables, botulinum toxin and fillers, and then they start introducing laser hair removal in clinic, and then skin rejuvenation treatments, which can be anything from laser resurfacing, Frax treatment, fractional non-ablative, and then we move on to the body treatment. So this is just really to give you an introduction about the market. The market is growing, the market is good, the market is healthy, and it's healthy in exactly the topics that we are going to discuss this evening. I really like this slide. This slide about the GentleMax or the Gentle series, it really is a powerful slide. Now, some of you might think, well, it's just a timeline of different devices. Why are you so excited about this slide? The reason I'm so excited is because this shows you the history, the heritage of the company of Candela, because we are often faced with devices that come out of nowhere. Engineers come together, they make up a device, company disappears after a year or two, whereas the Gentle series have stood the test of time. So you can see, going back to many years, there has been an evolution, and these devices have only got better, with more power, with larger spot sizes, with shorter pulse duration, more energy. And the reason this is happening is because Candela is doing what every laser company is supposed to do, and that is listen to its customers. So Candela has listened to the customer who's saying, well, I would like to have a laser hair removal device with more power, with a larger spot size, with shorter pulse duration, and this is exactly what's happening. So the reason I like this slide is it just shows you the progress and the history and the heritage in terms of science and engineering Candela has when it comes to the Gentle series. So now we are in 2023 and we have the GentleMax Pro Plus. And what are the unique features of the GentleMax Pro Plus? Well, there are a number of very unique features which differentiates this device from many other devices in the market. But I would like to start first with the spot sizes. So the spot size is important because you have a range of spot sizes, as you can see here on the left side, ranging from a very small round spot size of 1.5 millimeter, which in this case means we can trace and treat small facial vessels. Small facial vessels can safely be treated when we are using a very small spot size. I think this is important because some will say, well, I think the Nd:YAG is very dangerous on the face, and that's why I avoid using it. That is correct if you're using a large spot size, which many other competitors have because they lack the ability to have a very small spot size. Whereas with the GentleMax Pro Plus, you can have a 1.5 millimeter spot, which is very small and therefore very safe to treat small vessels on the face. If you go to the third spot, then we have this unique linear elliptical spot size, the 3x10 millimeter. Again, this is unique only to the GentleMax Pro Plus series from the Candela devices, where you have this linear shaped spot size that you can trace individual vessels, particularly useful for vessels in the leg. Then we have a specific spot size for onychomycosis, which is the 5 millimeter, and when you put that on, it will give you the range of the pulse duration fluence that you are supposed to use for onychomycosis. And then we have a number of round spot sizes, small to mid-size, for vascular, such as venous malformations, for diffuse pigmentation, and then we go on to the larger spot sizes for hair removal. So typically when we talk about laser hair removal, we want to have a spot size of minimum 10, 12 millimeter, and then above, and that is because of the depth of penetration. A large spot size is going to penetrate deeper. This is why it's important to have a large spot size. But that's not the whole story. If you have a 26 millimeter spot, regardless of the good depth of penetration, you're also having a larger area of coverage, which means the treatment is going to be faster. So if you're a business with busy patients, having a larger spot size means shorter duration time of treatment, and therefore you can fit in more patients. So multiple different spot sizes varying from small to mid-size to large, unique 5 millimeter spot size for onychomycosis, and a unique 3 by 10 millimeter elliptical spot size. So that's the spot sizes. So the GentleMax Pro Plus has two wavelengths, the 755 nanometer alexandrite, and it's an alexandrite crystal, and the 1064 nanometer Nd:YAG. So this is why it's dual wavelength. Multiple pulse durations ranging from a very short pulse duration, in fact, shorter than 1 millisecond. So we can call that microsecond in the Nd:YAG, and then ranging from a very long pulse duration. Why is that important? Well, small structures require shorter pulse duration. Larger structures require longer pulse duration, which means that we can treat effectively small vessels, fine hairs, but also can treat thick hairs and very large vessels. When we are using it in the microsecond domain, we can also use that for dermal heating and rejuvenation. We have high power, and the power is higher compared to the previous series, which is the GentleMax Pro. So we have the GentleMax Pro from a number of years ago. Now this GentleMax Pro Plus has more power, meaning that's on a large spot size, you can also have the choice of having a higher fluence. Then we have the dynamic cooling device, which is the DCD, which is a patent of Candela, where the cryogen spray is sprayed, first cooling the surface of the skin. That is important because cooling is there to protect the epidermis, and then the laser will be emitted. So you can see there are a number of advantages. Two wavelengths, 755, 1064, multiple pulse durations from very short to long pulse duration, multiple spot sizes, high power. And for hair removal, when we talk about the pulse duration, the shortest pulse duration is 2 milliseconds. But we'll be talking about this and the importance of it. Right, so you can see that we have two wavelengths. And one of the things that often comes up in conversation with colleagues is, well, so that is going to be hair removal, right? And that is going to be hair removal in the lighter skin types with the 755 and laser hair removal in the higher skin types with the Nd:YAG. That is correct, but that's not the whole story. Look at all the other things that we can treat with this platform. Now, so if we look at the 755, so that is a wavelength that's also strongly absorbed by melanin, which means we can also use it for superficial benign epidermal pigment. And it's also a wavelength that is strongly absorbed by deoxyhemoglobin. So hence we can use that for vascular lesions. There's also a mode to combine that with an Nd:YAG, which is often used in Asia for rejuvenation. This is why it can also be used for wrinkles. When we look at the Nd:YAG, you can see that the list is even longer in terms of the conditions that we can treat. So we treat darker skin types. So typically the 4, 5, and 6 with the Nd:YAG when it comes to hair removal, because it's safer. But we can also treat vascular lesions, diffuse redness, wrinkles, onychomycosis scars, and a number of other conditions. So this is an example of unwanted hair. So when we talk about laser epilation, in most of the cases, it's unwanted hair. So it's cosmetic reasons where patients do not want. And these are the type of results that you can get. This is just an example of laser hair removal. And you can see that also on the face. Now, there are a number of studies showing that hirsutism in women affects their quality of life. And by having successful treatment with laser hair removal, we can improve the quality of life. So this is not just purely a cosmetic treatment where we are improving the appearance, but we are also improving the quality of life. So a few words about laser hair removal. In terms of practicalities, you want to have a large spot size, so that's really a minimum of 12 millimeter, but aim for the larger spot size that is possible. Intervals, now that depends on the face. We typically say 4 to 6 weeks initially, and then depending after a few sessions as the hair growth slows down, then the gaps are longer. We start typically with short pulse duration, so that's the 3 millisecond. However, on the very high skin types with the very thick hairs, you can start with a longer pulse duration. So for both the Alexandrite as well as the Nd:YAG. But what is really unique about the GentleMax Pro Plus, that is so unique compared to many of the other competitors, is the ability to go down to 2 millisecond short pulse duration on the Alexandrite, which means that when we're getting some of these finer hairs, particularly on the face, as we treat after a few sessions, when the hairs become finer and we need a shorter pulse duration to effectively treat these hairs, this is where we win, and this is where many of the other competitors struggle. And that is because you need to have a short pulse duration to vaporize and treat these very fine hairs. And that is the advantage of the GentleMax Pro Plus that allows us to go down to 2 milliseconds. Now, this is a nice publication because what it shows is that we focus on unwanted hair, but in principle, there are a number of hair follicle disorders that if you actually use laser hair removal to treat the hair follicles, we can also have a secondary improvement in these conditions. And these are some of these conditions. So for example, with pilonidal sinus, it's well known, and this has been studied and published, that post-surgery laser hair removal sessions will reduce the risk of recurrence. Keratosis pilaris can also improve with sessions of laser hair removal. Hidradenitis suppurativa, particularly early stage 1, so that is the milder forms, but where I also am affiliated in Denmark. In our departments, we have treated hundreds of patients with laser hair removal together with systemic and topical treatments for hidradenitis suppurativa, and that works well. Pseudofolliculitis barbae, or what's also called ingrown hairs, particularly a condition that you see in the higher skin types. And you can see that here, that responds to laser hair removal too. If you look here carefully, it's not just the hairs that have improved, but these papular elements, these papules, or these tiny little bumps, if we would like to call them, they have also settled and improved by simply using laser hair removal. So really the take-home message is, it's not just the unwanted hair for cosmetic reasons, but it's also useful for some of the hair follicle disorders. Cooling is important. Now, it is particularly important when the pulse duration is short. And we know that when the pulse duration is shorter than 5 milliseconds, when you're firing so fast and with a short pulse duration, the cryogen spray is safer and better than contact cooling and cold air. And this is why we see many patients who had treatment with the GentleMax Pro Plus with the DCD on a short pulse duration. And then they go somewhere else, and then they get a burn, despite them looking at the same or comparable parameters, and that is because it's different method of cooling. When we are using a short pulse duration, and this is what we typically use for laser hair removal, a pulse duration shorter than 5 milliseconds, the contact cooling is superior to the other methods of cooling. So that is the part about laser hair removal. Before I move over to treating vascular lesions with the Alexandrite, Dr. Patel, are there any particular questions you would like me to answer at this stage?
I thank you. That was very interesting. And I think that if we can talk a little bit about how you specifically, if you want to go back to your photos here, how you specifically like to alter the way you treat when you treat some of these particular conditions. So you were talking about fine hair and short, as well as shortening and lengthening the pulse duration for some of these conditions, whether they're on the face or whether it's perifolliculitis barbae, pseudofolliculitis barbae. How do you make those decisions, and what do you like to do with the parameters to make them effective treatments?
Yeah, I mean, part of that is by publications and by what is being studied, and part of it will be the experience. So if we, for example, look at a patient like this with hirsutism, obviously a lighter skin type with a thicker hair. So now with the GentleMax Pro Plus, for some of those who would like to start maybe with a 10 or a 5 millisecond, that is fine. But I think after about 3 to 4 sessions, you really want to be down to the 3 millisecond and the 2 millisecond, because you're going to have better effects. And then when it comes to the pseudofolliculitis barbae, so if I go to this one, then obviously you are limited also by the skin type. So in this case, you are going to be using the Nd:YAG. And I will typically start with a longer pulse duration, so the 30 milliseconds, and I probably will not go below 10 milliseconds. I will actually test patch when I go as low as 10 milliseconds, because the risk here is that if you go to very low pulse durations in a skin type 6, that you potentially can get dyspigmentation. So with a pseudofolliculitis barbae, you're around 20 to 30 milliseconds, and as the hairs become finer, then you may go down to 10 milliseconds, but again, you need to be experienced. You do a test patch, meaning you will do a shot, you'll wait 24 to 48 hours, make sure that there is no intense erythema or some mild epidermal changes, which implicate that that is just a too short pulse duration for that skin type. So for the skin type 6, you would be careful, and I would start with the 30 millisecond and go lower. With the skin types 1 to 3, typically for many of these conditions, we will follow exactly the same way that we will treat for unwanted hair. So we will start with the 10 or the 5 milliseconds, moving quickly to the 3 milliseconds.
Thank you. That's really helpful. And it really does illustrate the importance of having those two wavelengths to be able to choose the right wavelength. What is, before we move on to vascular lesions, one last question. Your experience and your knowledge of the literature, the difference between treating a skin type 5 or 6 with 1064 versus treating a 5 or 6 with a diode, for example, a diode that's in the 800 nanometer range.
Yeah, I mean, it's very clear. A skin type 6 will be a no. And I know that some will say, well, we may have treated, but I think you're playing with fire. So the thing about the skin type, the thing about the diodes, so it will be okay with the 3, 4, possibly a little bit of the 5, although you're going to have to also be a bit careful. But with a 6, no. And even many of the diode companies will specifically also say that they don't have clearance to treat skin type 6. The Nd:YAG is safe to treat skin type 6. But the problem is that in the first 2 to 3 sessions, you may get results and then you think, well, this is working well. But what happens afterwards is the hair shaft becomes finer and finer. And then you need a short pulse duration to effectively treat these fine hairs. And that's where the diodes fail, because they are unable to give us a very short pulse duration. By nature, the diode is unable to generate a very short pulse duration, and this will be a limitation. So the limitation is the skin type. Skin type 5 is difficult. Skin type 6, definitely not. And I have seen burns, and I have some images of burns where I show with the diodes on the skin type 6. But the main issue also is lack of response because of the inability to generate a short pulse duration as the hairs become finer.
Great. Well, let me let you keep going. I know you've got a lot more to go.
Yeah, we still have many slides, so let's continue. Now, 755 and vascular. Now, some will think, well, how does that work? We've never heard about the alexandrite being used for vascular, and that is because if you look at this graph, we have 2 types of hemoglobin, because typically when we talk about hemoglobin, we refer to the oxygenated hemoglobin, which is the oxyhemoglobin, which is in red here. But there's also a type of deoxygenated hemoglobin, which you can see in the blue here. And you can see that around 755, where the alexandrite is, there is higher absorption in that wavelength for deoxygenated hemoglobin compared to oxygenated hemoglobin. In other words, venous blood that is rich in deoxyhemoglobin is going to absorb more 755 compared to oxygenated hemoglobin. So we can use that window here to treat some of these deoxygenated rich vascular lesions. So this is one of the first publications where this wavelength, 755, was used in hypertrophic and resistant port wine stains. So these are the port wine stains that are large. They have large vessels and deep, and therefore they will be also rich in deoxygenated hemoglobin, deoxyhemoglobin. These were the parameters used. So a 10 millimeter spot, good for depth of penetration. 3 millisecond because you want to get clinically purpura. Remember, the port wine stain are abnormal vessels, and you need to destroy them. You cannot coagulate them. So you destroy them by using a short pulsation. And this is the range of fluence. Now, again, it depends on the thickness of the skin and the skin type, but purpura as a clinical endpoint. So we know it works. And these are some of the images from the publication from Rox Anderson. And then also for leg vessels, for telangiectasia, it was studied, particularly for the slightly larger one, because you can see here it's ideal for vessels of 0.6 millimeter and larger. So typically these are going to be venials, which are a little bit more blue in color. So again, they were going to be richer in deoxyhemoglobin, so they will absorb this wavelength well. Now, in this case, using a longer pulsation would be better, because using a short pulsation, there's going to be too much of this melanin absorption. So in summary, if you're using it for port wine stain, it is for the resistant hypertrophic port wine stain, and using a short pulsation is important. When we're using it for telangiectasias and vessels, it's the longer pulsation, because the short pulsation, as you can see here, is going to be giving you epidermal injury. So you can see here that when 40 millisecond was used, it's safer. And this is important because sometimes at conferences, people will say, you can't use the alexandrite for leg vessels because you get crusting and blistering. This is correct if it was an alexandrite with a fixed 3 milliseconds. But with this GentleMax Pro Plus, you can choose a longer pulsation, and this is why it is safe to do so. This is one of the studies where I also was involved with colleagues from Vietnam, where we compared the long pulse Nd:YAG to the long pulse alexandrite with, so long pulse meaning a longer pulse duration, 20 and 40 milliseconds, and you can see there isn't much of a statistical difference with the Nd:YAG. So we typically always use the Nd:YAG for leg vessels, but for some of these leg vessels that are not responding to Nd:YAG, or particularly in the lighter skin types, because this is another thing, this can only be used really in skin types 1 to 3, you can use the alexandrite for vascular. So to summarize, 755 of vascular is targeting the deoxyhemoglobin, is good for the lighter skin types only. For telangiectasias, we want a 40 millisecond and a 6 millimeter spot. And for port wine stains, a 10 millimeter spot, but a short pulse duration of 3 milliseconds. Before I move over to the pigment part, is there any particular questions about vascular with 755?
I think we can keep moving, and if we have any additional questions, we'll take them all at once after pigment.
Sure. Now, so the 755 is an alexandrite, and therefore this is a wavelength that is absorbed by melanin, so which means we can also use it to treat superficial benign pigmented lesions, so like solar lentigos and freckles, because these are epidermal pigments. Now, the trick here is to switch off the cooling, because when we are having cooling, we are protecting the epidermis. So we are protecting the epidermis, and therefore the energy is going to be absorbed by the hair follicle. But if we switch off the cooling, that means the energy is going to be absorbed by the epidermis. So in essence, we are attacking the epidermis and therefore overheating the pigment. So this should only work for, once again, should only work for superficial benign pigments in lighter skin types. So not for deep dermal pigment and not for melasma. So the endpoint here is going to be darkening of the lesions, because that is the endpoint for benign epidermal pigment. Darkening, that continues to darken, and perhaps a little bit of that redness and erythema just around the pigmented lesions. So you can do that for a spot treatment or for a whole large area treatment. So I think this video is working. Can you see? Is it showing? So you can see this is what it will appear immediately after treatment. Oh yeah, so you can see the video there. I can see it, Dr. Patel, from here. Can you see it as well?
Yes.
Yeah. So So you can treat it. So you can use it for individual lesions. So imagine if you just have an individual lesion, you can use it, or you can use it for field treatments where you can use a large spot size, and then use it in a painting mode. That will get darker, but then you will get nice clearance. So here, for example, again, you can use something like a 10 millimeter spot, 3 millisecond, and start somewhere between 24 to 28 joule, 1 or 2 shots. You want to see that darkening, and it may require more than one session. So again, here, and I think this is one of yours actually, Dr. Patel. So this diffuse lentiginase using a short pulse duration, multiple passes where they get darker. So again, the 10, 12 millimeter spots, I don't think there's much of a difference between these two, using a 10 or a 12 millimeter. The key is using the short pulse duration, which is the 3 or the 2 millisecond, now with the GentleMax Pro Plus, switching off the cooling, and then using a fluence that's starting to give you that clinical endpoint. Now, when you have too much of that chromophore, you need to choose a lower fluence to get that endpoint. When it's a very light skin type with a very light pigment, then you have to compensate and increase the fluence. So sometimes, so before I move over to vascular and other things within the ag, perhaps about pigmentation, do you have any questions?
What do you think about that shorter pulse duration with pigmentation?
No, I think that shorter pulse duration does help. I mean, I have tried sometimes with the 10 and the 20, and in fact, that's actually been published, that you can also get improvements with the 10 or the 20 milliseconds, but you will need higher fluence. So there was a very nice study by Vic Ross where they did 40 millisecond, 20 millisecond, 10 millisecond, and 3 millisecond. And basically what was found is that with a 3 millisecond, you need lower fluence because you reach that endpoint faster. Whereas if you're using a 20 millisecond, you have to compensate and use higher fluence. And the problem with that is, if it's a skin type 3, for example, then you might have used just a bit too much fluence for the surrounding skin. So I typically think that the 3 millisecond is safe, because if we are going to use this, we are going to use it, strictly speaking, on patients of skin types 1 to 3. So the 3 millisecond allows us to use relatively lower fluence compared to the longer fluences. To the longer pulse durations. But you still can get improvements with the longer pulse duration, but you will find that you're going to need higher fluences.
I think that's a great point.
Do you also have a particular opinion about that? Because I typically use 3 milliseconds.
No, I think it's a great point. I think you're right. The rule of thumb always is to try to achieve your endpoint with the least amount of energy to the skin as possible, because that's the piece that I think controls whether there's an adverse event or not. And in Florida, where I'm practicing most of the time, we really have to worry about not only a mix of skin types, but the sunny climate. So all of our skin types are exposed to the sun most of the year, and their melanin is really activated. And so we're extra cautious there. But I love the GentleMax Pro Plus for these really large diffuse areas of pigment, because it's just such a quick treatment as opposed to something that's pulse by pulse.
I agree. And you can sometimes see who would benefit from that. This, what we call this peppering, this diffuse lentiginase on skin, a large area, which is going to be difficult, for example, with a small spot, treating that with a nano or the pico. And it's actually very practical and fast and easy to treat with a large spot size, short pulse duration. I can see there's a question, what about the shorter pulse duration of 0.5 millisecond? Now, that comes with a smaller spot size, so you have to also be careful. And with that short pulse duration, you require lower fluences. And that's really, I would say, is good for small areas. If you have small lesions that you're targeting, but not for field treatment. For field treatment, I still like the larger spot size and this longer pulse duration. But if you go on and use the small spot size and go on a shorter pulse duration, you can use that for some of the stubborn lesions, but you're requiring also lower fluence. And then sometimes colleagues would say, well, what about, do you like this over, let's say, the IPL, the PR 530? So my rule is high, low is low. When you have high contrast, then a higher wavelength will be better. So with a high contrast, when you have lighter skin type and dark lesions, the 755 will be good, which is because there's high contrast. So you don't need a very short, long wavelength. You can go with a long wavelength, which is high. When you have low contrast, so let's say you have a skin type 1 with very, very, very light lentigos. So that is low contrast. So low is low, meaning a lower wavelength. So that is when I think moving down to the PR or even the PL handpiece will be better. So you can start first with the 755 for these darker lesions, but as they become very, very light and fine, well, if you're lucky enough to have the PR handpiece or the PL, then you can switch over to that. Do you do it differently, Dr. Patel?
No, I think you're absolutely right. I think that those lower wavelengths have such a high absorption in melanin that you have to really weigh the surrounding melanin in the tissue, and so those inadvertently become for those lighter skin patients. And you're right. Why use something that is more intensive and more aggressive? Even in a lighter skin type, if you can get away with something that's going to give a gentle, diffuse overall treatment.
Great. And then I can see there's a question, does the 2 millisecond work better? Yes, it works well. So the only reason we were using the 3 milliseconds for diffuse pigmentation is because that was the shortest pulse duration we had when we were using the larger spot size. Now we have the 2 millisecond, definitely. You shift to the 2 milliseconds and that would work better. Okay, so I think let me talk about the Nd:YAG, and then this is all very interesting, and then we can take more questions. But we clarified some of the aspects of pigmentation with the Alexandra. Now, the Nd:YAG is a wavelength that is always feared by many and is the least loved, but it's actually a wavelength that can do a lot if you know how to use it. So it's a wavelength that is absorbed by all three main chromophores. So we use it for hair removal because of its melanin absorption. We use it in vascular lesions because of its hemoglobin absorption. And because it's also absorbed by water, which means generating heat, we can also use it for rejuvenation and tightening. So these are some of the conditions that we can use the Nd:YAG for. And why am I putting this slide on? Because it's not just about hair removal in dark skin type. Because this is often what colleagues tell me, I don't need an Nd:YAG because I don't do leg veins and I don't treat darker skin types. Well, that is just two of the many applications of the Nd:YAG. You can use the Nd:YAG in acne, and you can certainly use it in acne in darker skin type. I like to use the Nd:YAG in rosacea in higher skin types, and we all have seen patients with skin type 4 and 5 with rosacea. I think the Nd:YAG would be brilliant in that skin type, and it's much safer than, for example, the pulse dye laser or the IPL in the higher skin types. You can use the Nd:YAG for thick verrucas of warts. You can use it for rejuvenation. But what I'd like to say about the rejuvenation is you can use it in combination with many of the other treatments. So you can use it in combination with PRP, platelet-rich plasma, if you do that, or in combination with, even now with a microneedling radiofrequency. So you can do that in combination with some of the other treatments. For some of the thick scars, and in particularly, again, higher skin types. So if you talk about someone with skin type 5 and a 6 with a hypertrophic scar, now obviously that's not going to be treated with a pulse dye laser, but we can treat that with the Nd:YAG. And again, with the GentleMax Pro Plus, we have the 5 millimeter spot for onychomycosis. So there are a number of conditions that we can really use the Nd:YAG for in clinical practice. So this is one of them. These are the leg veins, typical. If you can inject with sclerotherapy, inject with sclerotherapy. But otherwise, the 3 by 10 millimeter elliptical spot size is particularly useful here. Pulse duration, that varies. Now, typically for the blue-green one, 40 to 60 milliseconds, so really long. For the red ones, 10 to 20 milliseconds. The very fine ones, 10 milliseconds. So if you don't know, it's always best to start first with a relative longer pulse duration, particularly in a bit of skin of color. This is where you can see in this video, you can see that with the linear elliptical spot size, the 3 by 10 millimeter, what you see is you get the vessel in the middle of that elliptical spot, so you can treat the vessels.
The treatment endpoint is spasm and darkening of the vessel. It is also possible that the vessel will disappear momentarily. Once treatment is completed, follow the post-care instructions found in the clinical manual.
So this is why I like to use the elliptical spot size, because the elliptical spot size allows you to really trace the individual vessels. And then again, if you look at these renals, so these blue thick veins, they are best treated with the Nd:YAG. Periorbital veins, I do a lot of them. Again, with the Nd:YAGs, if we talk about parameters here, I would start with a small spot size. In this area, so 3 millimeter, and then a 30 or a 40 millisecond. Then start with 130, 140 joule. And then I like to do extra cooling with an ice pack, and you look for the endpoint of spasm. Venous lakes here, beautifully treated just with the GentleMax Pro. And so this is where you need the Nd:YAG. And rosacea, and this is a patient with higher skin type. You can treat rosacea, inflammatory acne, you can treat with the Nd:YAG. There are a number of ways of doing it. What I like to do is I like to do the painting mode. So typically the large spot size, so the 10 millimeter, for example, using the short pulse duration, so that is in the microsecond domain, the 0.5, 0.3 milliseconds, and then with a high frequency, just multiple passes generating that heat, getting that erythema. And for the papillopustular components, I go with a smaller spot size. So the 3 or the 6 millimeter spot, depending on the skin type and how large they are. And then longer pulse duration, 30 to 40 milliseconds, and then do another shot on the individual lesions. So I like to do it that way, but particularly in the higher skin type, it works well. So last year I published on, this is my article in the Prime Journal, it's still available, the uses of long pulse and Nd:YAG in dermatology, so looking at a number of the conditions that we can use the Nd:YAG for. So this is my last slide on the GentleMax Pro Plus, before I will be talking about the Frax Pro. So what is unique about the GentleMax Pro Plus? Well, first of all, 2 wavelengths, 755 and the 1064, so we can do all skin types, skin type 1 to 6 with hair removal. But we can do many other things because I just talked about alexandrite once again. We can treat superficial benign pigments. We can treat deoxygenated hemoglobin, so some of the resistant vascular lesions, Nd:YAG vascular. We can use it for tightening. So we have a 26 millimeter spot, which is really large, which allows us to treat fast. We have a higher repetition rate, up to 3 hertz, and a shorter pulse duration down to 2 milliseconds. So before I talk about the Frax Pro, Dr. Patel, do you have any particular questions?
Yeah, there's a couple of questions from the audience here. When you are treating, and I know you do a nice job with the painting technique and skin rejuvenation with the 1064, the question is, do you ever stack pulses? Do you stamp? Do you paint? And then this question particularly is about stacking pulses. And I think it's worth us talking about particularly the YAG and stacking pulses, if you don't mind.
Yeah, so stacking with the YAG, you have to be very, very careful. And I would say don't stack with the YAG, because stacking with the YAG can really give you a heat spots, and you can quickly generate a lot of heat where you potentially can get atrophic scars and blistering. And I have seen many of these cases. So stacking, stay away from that with the Nd:YAG. With the alexandrite or pulse dye is different. No, it's painting. So painting literally meaning holding the handpiece and moving it back and forth, up and down. So horizontal passes, vertical passes. Now, the question is, how many passes? Now, that depends on your endpoint. I'll give you an example. If you are using, let's say, a 10 millimeter spot, okay, and on a 0.3 millisecond, if you're using a 6 joule, you will need more passes to get the heat compared to 10 joules. So the higher the hertz, which means the faster you go, and the higher the fluence, the faster you get to your endpoint. So you'll see that you quickly get to your endpoint. The lower the hertz, so the slower you are, and the lower the fluence, the longer it takes to get your endpoint, which also means more passes. So you cannot just count per pass. It's really the endpoint. This erythema developing, this gradual heat building up. The patient is going to say, it's feeling warm, I can feel it hot. You really have to have this external thermometer and aim for a minimum of 39, 40 degrees, if you get 40 degrees. Now, it is better, in my opinion and from my experience, it is better to do it a bit slow and gradually build up the heat than starting very high and quickly develop the heat. Because what you then get is you just get rapid building of heat spots and you stop, but you don't really have this uniform bulk heating within the dermis. But if you do it slowly and you gradually build up that heat, you're much more homogeneous and you have had more time for the tissue to build up that heat. And in my experience, you get better results.
Thank you.
Right. Was there any other question? You said there were a couple of questions.
No, I think we can keep going.
Okay, so now we're going to talk about the Frax Pro. So the Frax Pro, which is essentially the two non-ablative fractional handpieces, the 1550 and the 1940, they can either be a standalone, which is a device called Frax Pro, so you can just have the two non-ablative fractional handpieces, or you can have them as part of the Nautilus platform, where you can also have the Nd:YAG and multiple IPL handpieces. So we have two wavelengths. We have the 1550 and the 1940. And this is important because the tissue interaction is going to be different. Now, both of these wavelengths are absorbed by water, and both of them are within the non-ablative range because it's typically between 1200 nanometer, that's when you start to have really good water absorption, and then 2000 nanometer where it becomes ablated. So the 1550 has less water absorption compared to the 1940, and you see that here. So as we get closer to 2000, which is where the 1940 sits, there's so much water absorption that the wavelength acts very superficially because it's so highly absorbed by water. Most of it gets absorbed superficially. Whereas the 1550, because it has relatively lower water absorption compared to the 1940, it penetrates deeper. And that is shown also on the histology from Candela, where you can see the 1550 penetrates deep because it has a relatively lower water absorption. Whereas the 1940, because it has so much high water absorption, most of it just doesn't get the chance to penetrate deeper because most of it is absorbed superficially, which means the effects of the 1550 are more dermal, okay, so scars, whereas the 1940, the effect is more superficial, glow, tone, texture, and that is important because you can see here, 1940 superficial, 1550 deep. An important thing, some will say, how about using the 1550 but with low energy and then I'm still superficial? It doesn't work that way. It's a different wavelength. So even with low energy or fluence of 1550 is still in the mid-dermis. And with the 1940, you're still going to be superficial. But what is nice about this device is also the scanner width. So you can adjust the scanner width from a 4 millimeter to a 12 millimeter. So when you have a linear scar, you can adjust that and use the 4 millimeter and treat the linear scar. If you have a higher skin type and you're treating a larger area, it's better to use a 12 millimeter because the spots are further separated away from each other, so you have less buildup of heat. And sometimes you're going to have to combine these two. And this is why I really love this handpiece. And I think this is so unique compared to many of the other devices that I use, because really, as a doctor, this is exactly what you want to do. You want to customize your treatments. You don't want just a system that's going to do everything for you, because it doesn't work that way. The pathology of every patient is different in terms of the scar size, the skin type, and I like that customization where I sometimes use a narrow scanner with adjust the density, use a wider scanner width for the surrounding area. So I think it's really a big plus for this device. You can see here in the video how neat the scanner works from the device. So you can see that is just a roller that is attached to the handpiece. You can just detach that and cleanse that. But you can see as you move the handpiece, it's scanning nicely. That's with the 12 millimeter. And this is with the 4 millimeter. So that's the scanner. So now we can look into some before and afters. So obviously you need a number of treatments for scars, but this is where I like to use the 4 or the 6 millimeter scanner width on the individual scars to really make sure that these scars are being cooked and there's a lot of coagulation at the base. And then I finish off using the wider scanner width for the entire area. So again, some examples of scars, superficial scars and dilated pores, here in combination with the PR handpiece of the IPL, traumatic scars. So again, this is where I like to use the 4 and the 6 millimeters. So you really just trace that to treat the individual scars. Same here, just use the narrow scanner width for the scar. So some other example, this is your case. I think we did this together with the light and bright, with the IPL. And this is again another example of scars where you can see there are individual scars, but the rest of the skin is actually not really that affected. So here, this is where I like to use a 4, 6 millimeter on the individual scars. So doing multiple passes there, I really want to see the edema. So I make sure that there's coagulation at the base of the scar. And then I finish off using the second step, we're going to be the wider scanner width, but with lower density. So high density, narrow scanner width on the individual scars, that's where it really matters, which is a similar principle that we were using with the core CO2, where we will customize the scanner to the base of each scar and then using lower density for the surrounding area. And then again, 10 to 12 millimeter lower density for the entire area. So this is how I like to do that. And this is again, this is an image that shows real life. And I like to say, patients, look, this is after 3 sessions. This is what I can offer. And you have the advantage of faster recovery compared to some of the more ablative lasers. You can see this is slightly elevated scar, a little hyperpigmented, and it's flatter and lighter. Patient is very happy. Now, the 1940, it's really one of the game changers when it comes to the glow and the tone and the texture. And you can see here, it's not just the superficial pigment that's here, but there's a nice glow to the skin. The skin just feels smooth. It's the tactile element of the skin that feels so nice. And sometimes that's just difficult to show by photos, but patients say the skin is just feeling smooth and is looking nicer. So on the chest, you can combine that with IPL handpieces, or you can even combine that with the GentleMax Pro Plus with the alexandrite that we were talking about. And then just for that glow and smoothness and the texture, you can add in the 1940. You can combine that with some of the other things, like combine it with skin boosters, hyaluronic acid. You can combine that with a PicoA. So for some of the standouts, lentigos, you can hit them with the PicoA and then treat the entire face with the Frax 1940. So there are a number of combinations. So Sharon was one of my first patients. She was one of my first patients who was very happy with the glow. Why? And that is because we have 2 types of light reflection. When we have a smooth surface, we get this nice specular light reflection compared to this diffuse light reflection. So if you look at these 2 images, even though both of them have a mountain and water, the smooth water surface is giving us this nice light reflection. And the same here, if you look at these rocks, the collagen here is the same. So, it goes to show you that not everything in beauty is collagen. These are exactly the same rocks and the makeup is the same, but just because of the light reflection, the ones on the left-hand side of me look nicer. And this is actually something that's been studied and published. This is the International Journal of Cosmetic Sciences. It's a very nice article that shows that we human beings, when we look at someone within a millisecond, we decide how attractive that person is. But most of that is based on the facial radiance. In other words, the glow, the tone, the texture. Mm-hmm. So we often concentrate on the collagen and ignore the tone, texture, and glow. And that is what the Frax 1940 can do. So it's brilliant handpiece to combine with anything, really. You can combine it with the Profound Matrix. You can combine it with the 1550. You can combine it with the IPL, with pretty much anything. And every patient would be happy with the glow. And actually in Japan, they did a nice study where they put volunteers through an MRI scanner looking at the brain activity of that becomes active when we see someone who's attractive. And they show the same image of people, but from dull skin to more nice, homogeneous, nice glow and facial radiance. And all of the volunteers showed that the brain activity of perceiving someone as attractive was more when they were showing them the facial radiance and the glow. So we know that healthy skin with a nice glow and tone and texture definitely is the nice recipe for being attractive. So if we look at this patient actually came to me for her jowl. And you can see she had a HIFU treatment, and she was very happy with that. But what she was really happy about was the tone and the texture and the improvement in the skin quality after the Frax 1940, which I offered her at the same time. So I like to do a lot of the 1940 in combination with others. And if you zoom in, you can clearly see the massive improvement in just the quality of the skin from the tone and the texture. And not necessarily much in terms of change at collagen level. I don't think necessarily you're going to get a massive change in collagen level with the 1940. That's more with the 1550. But it just goes to show what the 1940 can do. So with that, would like to thank you all.